Hi, my name is Amy Kosick, and I'm going to talk to you today about collaboration in healthcare. So, collaboration in healthcare is an important tool for education or to affect change and to provide meaningful care to our patients with positive outcomes. Collaboration can also lead to higher patient satisfaction and retention of nurses. When professionals collaborate with other professionals, they are able to bring different ideas and viewpoints together to create one idea. In healthcare, collaboration among different specialties can lead to comprehensive patient care, which can have better outcomes for patients. Patients also feel that they are receiving better care when their care team works well together and will be more satisfied with their care. Nurses who work in environments with good collaboration will be happier with their job and more likely to stay. So there are many benefits to having collaboration in healthcare, and it is something that's important in all healthcare facilities. It has many benefits, and it is something that we all need to work together on. But you do need to have a couple of things in place in order to be able to participate in collaboration. So this might be a little difficult to see, but the antecedents for collaboration are teamwork, communication, social skills, so you can work with other people, training and interdisciplinary work, so you have that educational background to be able to collaborate, and understanding the effectiveness of working relationships. So you need to understand how to create these relationships and why they're important before you're going to be successful with collaboration. And the consequences of collaboration are to solve patient care or health system problems, provide appropriate care to patients, maximizing nursing productivity, affecting change, having an efficient use of resources, improved patient satisfaction, and nurse retention. So when we collaborate together, we can all work to the fullest extent of our own practice because we have these other people to support us. So for my case study, patient JD is an 87-year-old female admitted from home with respiratory distress and COVID-19 infection. She is in the ICU, currently on a ventilator. During daily interdisciplinary rounds, the nutrition pointed out to the attending physician that the patient was not currently receiving any nutrition. The physician was able to order tube feeds for the patient, since he knows that optimizing a patient's nutrition can help the patient to get better faster. The physical therapy team and nursing were able to discuss a schedule for proning the patient, since many staff members are needed to safely prone a patient. So they were able to come together with a schedule so that everybody was there exactly when the patient needed to be proned and no time was wasted. The case manager was able to discuss the patient's current condition with the entire care team to be able to have a better idea of what the patient's needs may be at discharge. She was also able to communicate the family needs with the care team in regards to receiving updates and what they may be able to do to accommodate her at home if she were to get discharged. The nurse was able to address concerns regarding the patient's blood pressure with the attending physician, and new medications were ordered at that time. So the few minutes spent on that patient in interdisciplinary rounds were used to address all of the patient's needs for the day, so that the care team was able to focus on their specific tasks. All of the involved specialties were able to offer their input. It was well received and respected, and the patient's care was improved because of it. So you can see that that's a really good example of how collaboration and interdisciplinary participation can have really good outcomes for our patients, and it can make our lives at work much easier. This is just a patient care example. It can also be applied to making changes in the healthcare system and improving education, especially with nursing education. And here are my references.